Okay, we are going live. Hey, you made it. You made it. This is another fantastic Monday How to Pass Nclex. You made it live. This is my favorite day of the week, and I am here with you guys, Callion, and I have created five new Nclex questions for you on today. So we are going to get into it, but please do me a big favor. Like this video, share, and subscribe to my YouTube channel so that you always know exactly when I go live. Hey, how is everybody doing? Shout out to, tell me where you're from, because I was just telling somebody the other day, we have nurses from Dubai, the Philippines, Africa. I love it. Chicago. Shout out to my nurses in Minnesota right now, still studying with me. I appreciate it. Hello, everybody. All right, we're gonna get right into it. I'm still shouting you out, family. It's ReMar review, and question number 1 here is this. A nurse is reading a progress report on a newly admitted client. The client tells the nurse his medical history in a confused manner. Which statement made by the client is the best example of the client's use of splitting? Number 1, there are too many clients in the hospital for me. 2, I have split personality disorder. I am sad. 3, all the nurses are mean to me, but you are nice. 4, I see 3 men and 4 women on my unit. Okay. Got a little psych there. Which one is the correct best example of splitting? And I did this one before, a different scenario. I did this one before because it's very important that you understand this term. So if you're watching it for the first time, you're just joining us, we are trying to see where we need to study. We're trying to see where we need to study before we take our Nclex exam. All right, we got to pass Nclex, and the way we do that is through studying ReMar content. All right, so the correct answer here, I see the answers rolling in. Shout out to all the live viewers. All right, it is going to be, oh yeah, you got it. Number 3, when the client says, hey, all the nurses are mean to me, but you are nice, they are splitting you out from everything else. So splitting is a very common ego defense mechanism. It can be defined as the division or polarization of beliefs, actions, objects, persons into good or bad categories, but selectively focusing on positive or negative. So if you get this on your Nclex exam, if you see good or bad, right, then that is going to be your example of splitting, okay? That is going to be your example of splitting. Okay, I got to move on. Time is rolling. We got to go. Let's look at the next question here, okay? The next question is question number 2. Oh, yeah, I love it. Question number 2 is this. A client who is being admitted to the psychiatric unit tells the nurse that he hears sounds and voices. All right. Which question is best for the nurse to ask effectively to effectively develop a plan of care, right? All right. Number 1, where do the voices come from? 2, what are the voices saying? 3, how do you explain that you have voices? 4, when do you hear the voices? When do you hear the voices? Yes. Okay. So we are here dealing with a client who hears voices and sounds. Yes. Okay. I'm looking for the best answer here. Okay. All right. Here we go. Here we go. I see the answers rolling in. You guys are on one accord today. That means I don't see a lot of variation. Excellent job, guys. Excellent job. You got this one. The priority of the nurse is to determine what the hallucinations and voices are. What are they exciting the client to do, encouraging the client to do? This is going to be very important to determine what the care plan should look like. All right. So safety is huge on Nclex. You guys know that. Safety is huge on Nclex. So where do the voices come from? Number one, that's not important, nor is it safe, nor is it a safety question. Okay. How do you explain that you have the voices? Not the priority here, not the priority. All right. So, and then hallucinations, you want to understand what these extrasensory perceptions are coming as. All right. All right. So the idea is when you look at these options, not, well, do they make sense or anything, but it's just like, can you pick the correct one from the choices that you're given? All right. So you may be able to look at one of these options and says, well, it makes sense to ask, when do you hear the voices? Yeah, it does make sense, but you have to pick the best one from the choices that you're given. And so number 2 is the best one. That's where we're going with that one. All right. Question number 3. Here we go. Here we go. Oh, this is a good one. A nurse is caring for a client with respirations at 30 breaths per minute. The nurse finds the breath sounds to be shallow with crackles present. The client is receiving D5W at 20 milliliters per hour. Which is the next action by the nurse? Number 1, turn the intravenous fluids off. 2, notify the healthcare provider. 3, obtain the oxygen saturation. 4, order an X-ray of the lungs. Okay. Woo, this is a good one. And this is where we're going to divide out. This is where we are going to have division of answer choices. And I hope you guys have the rationale for why you are picking what you are picking. Okay. I hope you guys understand why you're picking what you're picking. Oh, this is good. This is a good one. Okay. I'm just, all right. Put your answer down. Share this video right now. We are studying live with remarreview. Hey, if this is your first time joining us, we do this for free every Monday. We get together and we go over Nclex questions. Never heard of before, but we do it here, remarreview, because we love you guys and we want you to pass your exam. So thank you for doing your part and showing up. All right, so I'm going to put the correct answer up here. I see there is a division. Well, there's a lot of 1s and there's a lot of 3s. A lot of 1s and there's a lot of 3s. All right, here we go. Here we go. It says, what is the next action by the nurse? All right, here we go. The correct answer is going to be number 3. Oh, yeah, you got to obtain that oxygen saturation. Okay, because this is going to, all right, this is going to help you to assess more about what's happening to your patient. Remember, the first part of the nursing process is assessment. You want to get as much information as you can before you call the doctor. And a lot of you guys picked number 1 because you saw that the patient was receiving IV fluids. But guess what? Look at that rate, 20 milliliters per hour. Is that a big amount of fluid, 20 milliliters an hour? Is that a huge amount of fluid that's going to contribute to fluid overload? No. Is what we consider to be a keep vein open, right? It's a very small amount. It is a very small amount of fluid. So that is not going to be the priority to turn that fluid off. It's not going to be the priority to turn that fluid off at all, right? But because in the people who pick number one, you guys, it's not that you don't know a lot of information, it's that you do. And so we're so used to seeing IV fluids connected to fluid overload that this is a really great distractor. This is a really great distractor because if you're not reading the stem of the question correctly, then you will just automatically pick that IV fluids, not even looking at the 20 milliliters an hour, okay? Not even looking at that. So it is a good distractor. Yes, it is. It is a good distractor. So the question is, all right, this patient, they do have 30 respirations per minute, right? They do have 30 respirations per minute. We know that's abnormal. That's not okay. And then we also know that they have shallow breaths with crackles. Crackles indicate fluid, right? Crackles indicate fluid, but we can't connect the D5W to this fluid overload. It may be coming from somewhere else. So the priority then becomes, what is my patient's oxygenation stat? How is my patient doing? I need more information because a lot of people didn't pick number two. If you call the healthcare provider, you guys know that if you call the healthcare provider, what are they going to ask you? It's possible they'll ask you, what is the oxygenation saturation of the patient? What are the SATs doing? And if you haven't acquired that information, then you have not done your part to facilitate an effective communication between a nurse and a healthcare provider, or a nurse and a doctor. And so you always have to do your part for Nclex. You can't just call the doctor and say, tell me what to do. The doctor is relying on you to use your assessment skills to tell them what to do, right? And so nurses are so important. And everybody thinks the doctors are certainly important, but the doctors make decisions a lot of times based off what the nurse tells them about the patient. So option number 4, a lot of people picked option number 4, which is order an x-ray of the lungs, okay? Order an x-ray of the lungs. And I understand the need to have an x-ray of the lungs. I understand it, but is this something that the nurse can do? All right. And so everybody that picked number 4, there were a couple people on Facebook that chose this. You guys want to go back and look at your the scope of practice for a nurse, because we actually cannot order diagnostic procedures, even though the client may need them. Yes, we know this patient needs an x-ray of the lungs, but as a nurse, we cannot order that. Okay. So that would not be a correct answer at all. Okay. All right. How about this? Oh, and I like that somebody brought out this point too on, I'm looking at it on here, we don't have to worry about the IV fluids because it's not a matter of the IV fluids causing this fluid overload. It's at a keep vein open rate. And so if you don't know what keep vein open means, okay. So question number 4 says this: a husband is unsatisfied with his wife's at an assisted living facility. The husband states he is moving his wife out and going to sue the nursing staff. He begins to yell and pack his wife's belongings. Which is the best action by the nurse? Okay. Number 1 says, notify the facility's security staff. 2, notify the healthcare provider to speak to the husband. 3, advise the husband to stop yelling and remain calm. 4, talk to the husband and ask questions about the wife's care from his perspective. Okay. We have a lot of things going on here. You have a husband who is upset. He's going to sue he's going to sue the nursing staff. He's going to personally sue everybody on the nursing staff. Listen, this could happen to you. Patients' families get very upset. I'm taking my wife out of here right away. She's getting out of here. I'm packing stuff up now. What do you do per your state board exams? All right. Because remember, in Nclex, it is a perfect world. Okay. And you want to go with the answer that is best suited to facilitate a therapeutic environment. All right. That's all I'm going to say. So some people are between 3 and 4. I do see that for sure. All right. So let me just show the right answer. This is studying. All right. First, the correct answer is going to be, it's number 4. It is number 4. All right. Number 1 says notify the facility security staff. That is not going to be therapeutic at this time, because you can try to engage this husband. Okay. You can try to get him to express his feelings before calling security on him. Security at this time is not going to be appropriate because they're only going to escalate the situation. They're only going to make the husband even more upset. If 2 security guards come into the room, now you're really going to have a hard time talking. He's not going to appreciate this call. All right. Especially if the husband is yelling and upset and you call a doctor and say, hey, can you talk to this man? The doctor is going to be like, I'm in the middle of surgery. All right. So we really want to try to limit us going to the doctor. All right. Nclex doesn't want to know that anytime the situation arises, you're just going to call the doctor. Calling the doctor is very difficult. All right. In terms of making sure you have the correct doctor, making sure that you're talking to the attending and not the intern. If you call an intern with this situation, they're going to say, what am I supposed to do? Because remember, they're new doctors. So the correct answer, a lot of people pick number 3. Let me address number 3. Number 3 says, advise the husband to stop yelling and remain calm. Okay. That is not going to be correct because the husband does not want to hear you tell him. The husband does not want to hear you tell him. Says to them, calm down. What does that make the person do? That makes the person get even more upset. Like, don't tell me to calm down. You calm down. So telling somebody to remain calm is super annoying when you're upset. All right. So the correct answer is try. Okay. Yeah. Number 3 is you trying to tell the doctor the husband what to do is going to make it worse. 4 is going to be the correct answer. We want to try to get to understand why exactly is the husband upset? Why is the husband upset? Okay. Where did the gauge, and we can give our feedback, or we can just listen. Remember, part of therapeutic communication is sitting in silence. You don't have to say anything at all, but that's going to be the best course of action based off of the choices that we're given. So now, hopefully, if you see another question like this, you will know, I would pick talking to the husband over calling the doctor or calling security. Okay. We don't want to do that. We don't want to do that to our patients. So mark this one down if you didn't get it right. And shout out to everybody that's participating and getting these comments right. I appreciate it. You guys showing up. Okay, how about we do another question? Here we go. Question number 5 says this. It says this right now. Okay. All right. This is a good one. An important intervention in monitoring the dietary compliance of a client with bulimia is number 1, allowing the client privacy. 2, praising her for eating all her meal. 3, observing her 1 to 2 hours after meals. Or 4, encouraging her to choose food she likes and that should say to eat in moderation. Apologize for that. To eat in moderation. Okay. Which one do you guys think it is? 1, 2, 3, or 4? 1, 2, 3. All right. I got the answers rolling in. Rolling in. All right. We're talking about a client here with bulimia. And let me see if I grab this here, if I can find it. Oh, yes. Okay. So bulimia is one of the topics that we do review in Quick Facts for Nclex. All right. So if you have it, oh no, that's all. There is a section for bulimia nervosa. So you guys know the difference between the two of them. I see the answers rolling in. I think you guys got this one. All right. Somebody said, I need that book. All right. Okay. All right. Here we go. The correct answer, guys, is number 3. Absolutely. This is most appropriate for bulimia because you guys know that after they eat, if you don't know what bulimia is, you gotta look it up. All right. But bulimia, you guys know that usually with bulimia, you don't have a problem. You don't have a problem with they will eat. So you don't have to praise them for eating all their meals. You don't have to watch them eat the meal because they will eat it. But then what do they do after they eat it? Then after, part of that cycle is to purge the meal. So you want to observe them after that meal, right? You want to see what they do after that meal. This is to watch them for vomiting, of course. All right. So this is going to be the correct answer here. Woo! Shout out to the ReMar nurses. 5 questions out of 5 questions today. Hey, or 4 out of 5. That's always great too. The whole point of us doing these exercises is just to evaluate where we are. So topics today, we had psych situations, we had eating disorders, right? And we also had a fluid overload potential complication. So shout out to the topics that you have mastered, all right? And you did very well. This whole study session was brought to you by the Nclex virtual trainer. Right now, we have 7,400 nurses in there right now, 7,460 to be exact. And they're studying right now. But I'm going to give out some ReMar roses before my next segment. And this is to all the nurses who passed last week. And this isn't even all of them, but this is the ones that we're presenting for today. I'm sure we have more coming up. Our first one is Nurse Bree. Oh my goodness. She says, I love ReMar. I'm not even saying on a learning level. She says, I'm speaking on an energy right now. I was so devastated when I found out I didn't pass my Nclex PN the first time. Ooh, that's so annoying. I know. She said, I would randomly cry, stress, and just go missing in action. Can anybody feel her right now? Cry, stress, missing in action. She said, I started watching your YouTube videos and they were just so inspirational and it inspired me to boost my self-confidence. And she said, again from watching you. Also, that book, I loved it. Straight to the point, and it was info that helped me pass my test in 60 questions. All right. Thank you. I'm so glad I discovered you because you helped me discover the knowledge and confidence that I had and didn't know. She said, I highly recommend it. And she wanted to have her Quick Facts book in the picture with her pile of books, but she actually gave it to a friend who was studying it. So shout out to Nurse Bree. Congratulations. New PN practical nurse. I'll tell you about her. She graduated nursing school recently, end of 2019 in December. Okay. She started studying with the VT around March at the beginning of the COVID lockdown, right? So I got a message from her. She said she canceled her Nclex VT account on Thursday because she was testing on Friday. So she canceled it. And her results this morning, and officially, thank you, Miss Regina. Your program is amazing. So Nurse Bianca, shout out to you. Oh my goodness, these ladies are inspiring me. They are inspiring me. So who's next? I got one more testimonial for you guys. Check it out.
For this gift to me, I passed my LPN. Thank you, Regina. Thank you for the program. Your ReMar review is the best tool we can have to success Nclex. And if I can, you can. Remember, I can, I will, I must. Always believe in yourself and things come true. Thank you.
Okay, and I just want to say, I think one of the best parts about seeing people pass during this whole coronavirus thing, when everything is crazy and stressed out, and you guys are taking the modified exam, you are coming through for yourselves, your family. You are sitting down and saying, you know what, things have not been easy, but this is my dream and I have to take ownership of it. Remember, you guys, you are your own business. Everybody here, when you get a license, you become the CEO of that license. So keep that in mind. Keep that in mind. Hey, I had 86 new ReMar nurses. I had 86 new ReMar nurses sign up this weekend. I'm so super excited about that. Remember, right now we have the virtual trainer. If you don't have a comprehensive study program, this is the one that you need to be getting. All right. It's only $189 for 6 weeks of training. And that's my program. My program is 6 weeks of training. People do it in 2 weeks. People do it in 3 weeks. You get 3 months access to the program. It only takes about 6 weeks to get your license, okay? And then you get my 2 favorite books ever in the universe. I wrote this one, Quick Facts for Nclex, for nursing students who just need to study on the go and don't want to spend a lot of time trying to read paragraphs and paragraphs. And then, of course, the Nclex Virtual Trainer Student Workbook is the companion to the online lectures. So you get the writing, you get the videos, and you get everything you need to pass Nclex. I'm telling you guys, if you're taking the modified Nclex with 60 questions to 130 questions, the virtual trainer will get you prepared for that Nclex exam. So quit fooling around, all right? And let's get this comprehensive review done. All right, done. My Monday motivation topic, and I'll answer your questions. I'll answer your questions at the end of this really quickly. Let me give you my motivation for this week, because you guys know it's more for me than you. This is my motivation for this week, but I'm going to share it with you guys because I love you so much. All right. And the topic is just simply Monday. And this is a post that I put up on Instagram. And simply, there's a lot of things that you could think about, but here's the truth of the matter. Monday, maybe this is not one of your favorites, but never forget that every day you wake up is an amazing gift, and it's up to you to make it count. Let me read that again, okay? Because this is what Monday stands for, in case anybody has gotten ungrateful, unappreciative, in a funk about where they are in life, right? Just unhappy with what they have. Monday, maybe this is not one of your favorites, but never forget that every day you wake up is an amazing gift, and it's up to you to make it count. And so this is what I tell myself this morning: get up and let's go. All right. And so you guys know that as the days go on, it becomes very difficult, very challenging for me to get up with the same energy, with the same fervor, and try to make everything as it should be, right? So somebody said, are you pregnant? Yes, I'm pregnant. I'm 7 months now, and it's just a chore to do anything, right? Especially Mondays, because you know you have a whole bunch waiting for you. But got up this morning. You got up this morning. There are many people who did not. There are many people who did not. All right. And so we have to have the ability to get past our feelings and say, I need to make this opportunity count. First of all, recognizing that you have an opportunity. Many of us, you guys, are already in positions that people are praying for, right? Many people are praying to get in nursing school. Many people are praying to become a nurse. You guys are at the end of it. You guys are already through nursing school. You're literally at the tail end studying for your board exams. How amazing is that opportunity? Like, how could we neglect just that? On top of being healthy, on top of having our sight, our vision, the movement of our limbs. Come on. We got to look at this thing and say, I have to love this day, right? Because this is the day that the Lord has made, all right? And this is like, this is the time now that you have. We're not given a whole bunch of time, but what are you going to make of the time that you're given? And so this is my reminder for you guys for today. Okay. All right. Yes, I needed that motivation. That motivation was for me. I hope you guys enjoyed it. All right. So we are going to transition. Remember, Nclex virtual trainer, you can get it at remarnurse.com. That's where all of my products are. Any product that I have, you will see there. Okay. Let me see. I did get Chinwe. I know you. Did I say that right? I did get the baby shower gifts. I'm transitioning into question and answers now. Okay. If you didn't know, everybody who sent me baby shower gifts from the Amazon link, I got them and I'm sending you responses. So you should get your response from myself and Mark. Mark says hello right from Amazon. Okay. And I'm loving the gifts. We're going to do the baby shower virtually and it's going to be great. Okay. We're going to be great. What other questions do you have for me? I'm transitioning to Nclex questions now. I see that somebody said, do you think that they will extend the modified Nclex, right? Okay, so the modified Nclex right now, where you get the minimum of 60 questions, maximum of 130 questions, is set to end September the 30th. Okay. Now, it is just July still. So any kind of prediction that is made really is just my intuition. All right. So somebody said, do you think they will extend it? I think they will extend it only because I don't see much changing by September. We probably won't have a vaccine and we won't have any other new recommendations about a miracle drug. So I do think that they will extend it. And also because I see, schools opening up virtually and having a real big challenge of how to keep students separated. I don't think much will change for the Nclex exam. Now, I'm still hoping, you guys, just keep this between you and me. Don't say anything. I am still hoping that they might offer Nclex at home. This is something that I've been talking about since like April, taking your Nclex exam at home. But remember when I asked them about it, they said that that was not something they were considering. So you don't know. Desperate times call for desperate measures. But if you're taking your exam in October or November, you're probably going to be taking the modified Nclex exam. But we will see. We will see. All right. Okay. Here we go. What else? I'm sorry, I didn't get that question. Can you just tell me?
How many questions on Nclex, and then also how much will you make after Nclex?
Oh, okay. How many questions on Nclex? So the minimum questions that you can get right now for those of you who are taking it is 60 questions. That means they have cut out all of the pre-test questions on the exam. So 60 questions, whether you're RN or PN, and the maximum is 130. Okay. And how much you can make after your Nclex exam? It depends on where you live. number one. And it depends on what license you're getting. So if you're getting a PN, a practical nurse, I think your minimum should be about $22 an hour. And that's the minimum. Some PNs are making, much more than that, 27, 28. You guys know, whenever I get a job posting, I'll put it up on Instagram so you guys can just see like what kind of job offers I'm getting. And so I got a job offer that I posted on Instagram. Let me check it out. And it was for a tele position, and that's telemetry, cardiology. I loved cardiology nursing. And so for me, I liked cardiology nursing because my patients were adults and they were walkie-talkies. So that means that they could take care of themselves. They can get up, go to the bathroom. Most of them, I just had to monitor their heart rhythm. So I got a position there in Cleveland, Ohio, and that was for $54 an hour. And then another one was for $47 an hour. So this is an RN with 2 years experience. Okay. All right. So that's the kind of salary that you guys can anticipate. For sure. Okay. Somebody says, please give the baby my name. All right. How do I go to get the study book and sign up for your class? I took Nclex twice and did not pass. Okay. So that's easy. To get any of my products or to get my comprehensive review, you just go to remarnurse.com. Okay. And then once you go to remarnurse.com, please, if you've taken Nclex twice, you're still in a good place, because that would discourage me. So as long as you're not discouraged by it, then you can move on. So, and get the virtual trainer. That's what I tell you. That's what I'm going to recommend you to get. Okay. All right. YouTube. Okay. Let's see. It's $25 long care unit. Okay. $25 for the long-term care unit, $4 shift differential in North Carolina. All right, cool. Oh yes. Okay. Can you give us a update on the question bank book? So the question bank book is still sold out. We is the LPN sold out too?
There's like 10 more LPNs.
10 more LPN question bank books. No more RN question bank books. Online question bank. Hopefully it will come out this week. Prayerfully this week. We it was delivered to me. I actually have some ReMar nurses in there right now testing it out for me to make sure that it looks good. And so once we have that, once they tell me that everything is good, the assessments are working and all those things, then we'll release it to you guys. It's almost there. So please, just continue to be patient with me in this process. I want this program to work flawlessly for you guys. I know how much you need it. I know how much you guys want these questions. And so I'm just making sure that before I open up the question bank, that everybody can get into it and we don't have any problems. Because you guys know when I release a new product, you guys literally shut down my website, right? Literally, you shut it down. So I don't want that to happen when I open up this online question bank. I don't want it to happen. So just give me some time. Can you let us know how to get the first shift book? Is first shift sold out? No. First shift, it's not funny.
You can do an event.
No, it's not funny. I'm going to do an event on the first shift book. A virtual book signing. Yes. And I'm going to read first shift and then it'll be available soon. All right. First shift is the book that I wrote for new nurses, how to dominate your first 2 years of nursing. And so that book sells out so fast. I can hardly keep up with it. I can hardly keep up with signing them. I don't even think I have any in the office here. All right. Can I have questions from the BT? So no, the online questions, what I'm going to do is I'm going to send out an email for everybody who has the virtual trainer. And I'm going to put a link in the VT for you guys, because you will have to get the questions from outside of the virtual trainer. So it'll be another website that houses the virtual trainer questions. They're not going to be able to be into the virtual trainer. So you're not going to be able to sign into your virtual trainer and get the questions because of the programming. The programming don't mix, because with the question bank, you have the ability to choose your questions and make them. I was trying to see if I had it on my phone. I was doing questions on my phone from the question bank last night, but I don't know if I have the link up still. But yeah, it'll be a different website, and you can literally do them on your phone or your laptop or however. Okay. The baby registry link, I'll put it up again. Kathy says, I have my first shift. Yes. Kevin, you made a YouTube video about ReMar. Can you share it with me? Can you put the link in here, Kevin, so I can see it? Okay. Are you only doing lectures online, or if we pay for the VT, can we find them there? I'm buying a computer this week. I don't like the phone method. You can totally listen to VT on your laptop or your computer. You don't have to be on the phone at all. I was just saying a lot of students do like to log in on their phone and study. So I made the question bank, and the VT, you can also do it online too. Okay. How do I order the question bank? When we put the question bank out, you will have a link to purchase it. And the cost of the question bank will be $29 for 30 days. Okay. And you'll get 1,200 questions. Is it advisable to have VT first before getting your ATT? Your ATT, yes. I would say yes, because when you get your ATT, you want to be able to schedule your exam and test, right? And so with the virtual trainer, you have 3 months of studying. So you can get started with your VT while you do your, while you wait for your ATT to come. All right. Okay. All right. Kevin gave me a thing. All right. I'll check that out. Do you have monthly classes? I have weekly classes. We do this every Monday. We answer questions every Monday. Plus, I do special events. So we just finished ReMar Nurse University last month, where we did all pharmacology. The next thing that I'll be doing is next month in September or August, I think. I have other things coming on. The question bank is coming out, so there'll definitely be a lot of things. But if you get the virtual trainer, you can have me every day for 3 months, and that's me being your personal virtual trainer. All right, and nothing's better than that. Okay. All right. Let's see what else. Somebody says you have your question bank book. Yay, I'm loving it. Okay, cool. We did have some PNs. All right, somebody says, are your products only for Nclex? Do you have anything for someone who's entering nursing school? I do have the Quick Facts for T's book. If you're entering nursing school, that will be really helpful for you for the science section. Otherwise, as a new nurse, I'm coming for you guys. Okay. Oh, okay. All right. Do you know if the passing rate is increasing with the modified test? I've taken the Nclex twice and brought your program last year. Okay. Nope. So what they say is that the passing rate has not increased with the modified exam. Okay. So that means that even though they have taken out all of the pretest questions, the difficulty level is still the same from what they're seeing with the RN and the PN. Okay. So don't worry about the test being more difficult. I would say, if anything, our nurses here are passing it at a tremendous level. I think the virtual trainer over prepares you for, especially the virtual trainer PN. I think the virtual trainer PN over prepares you for Nclex for your actual exam. So definitely don't worry about that. I have the old program before the VT. Is that okay to use? Well, yes, it is. The content is going to be solid. The virtual trainer is just going to challenge you more. And so some people may need that. It really depends. If you can get the virtual trainer, I would, because I've expanded a lot of the information, especially if you're an RN. Definitely get the virtual trainer. Can you get the question bank without having the virtual trainer? If you are a past customer of the virtual trainer, then you'll get an email for the link to sign up for the question bank. And so we're going to do the virtual trainer people for the question bank, because it's the question bank for the Nclex virtual trainer. So I wanted to make sure that those people who have gone through the VT and all the information get this question bank to really challenge them. And so we're going to prioritize them. Like we said, we have 7,000 people already in the VT. So 7,000 people into the question bank is going to be a lot of people at one time. So we want to make sure that they're able to get access to it. And then if they're not ready for it, we'll open it up to everybody. Okay. Do you think once the Q bank is released, it is possible to get through all 1,200 questions for RN before August the 10th? Shanita, before August the 10th? What month is this?
Should that be the goal?
Is that a goal? Is this July?
Yeah, it's 20 days.
Okay, 20
But
days.
is that the goal though?
Well, maybe that's her goal. You can be exposed to them. Yes, you can do all 1,200 questions, and you probably can do an assessment. It's just a matter of being able to digest all of that. That's a lot of questions, but I think you could possibly do it, Shanita. If you weren't doing anything else and you just had to focus on the questions, then I think you could. Yeah, I think you could. I don't ever want to say, you guys surprise me all the time with what you can and can't do. So I think you can do it. It's time to tell students to repent in Jesus' name. Yes, Jerry. Yes, I agree with that. I think everybody, the way the world is going right now, if you think that we can continue on like this, oh no. Jesus is coming soon. All right. Please, I finished a long time ago for PN. How can I pick up because of thinking of going for my exams? It's all right. If you've been at school for a while, if you come here and you study and you learn and you have a good time, then you can definitely pick up. Get in the question bank, figure out what you need to do. Not the question bank, get in the VT for your comprehensive review. Figure out what board of nursing you need to apply to and what paperwork you need to turn in. All right. Is there a time schedule for completing the virtual trainer? Yes, absolutely. In your file vault, there is a calendar for you, and you can definitely go by the calendar that I created for the program, and you can skip ahead, make it shorter, make it longer. That's the beauty of it. Okay. Somebody asked them, did they still increase the difficulty level for the PN in April? Yes, they did. Even with everything going on, they still increased that difficulty level for the Nclex PN. So if you're taking the PN exam, you're taking the more difficult exam. So that's why I said take it seriously. Okay. Yes, absolutely. Since the first shift is sold out, can you announce when it'll be available? Yes, I will definitely announce it. Okay. Yes, you can also, you can also see these lives for Monday in the virtual trainer as well. Yep. VT is on sale. It's discounted still. So right now it is $189. It is $189. All right. And so the normal price of that when we first released the virtual trainer, you guys know it was $369. So we still are keeping it at a very, very, very reasonable price. All right. Somebody says, I have the question bank book. Will the online question bank be different? And so that answer is yes. Yeah. Yep. Yep. Absolutely. So here you go. If I have the 5-star quick facts, how much will I pay for VT? If you have the 5-star quick facts and you go to purchase your question bank, then why do I keep saying question bank? Because I want to. You will pay $169. You will pay $169 for that. Okay. All right. Okay. So that's it. How do you advise? All right. Okay, here we go. So what's included with the VT? So with the VT, you get the online review, my online review. Oh my goodness, I wish I could show you guys. The whole catalog of the lectures, right? Comprehensive review, plus you get, and that's instant access. You get the before the books arrive section, so much. And then I send you these 2 books. Team ReMar actually sends you these 2 books. They send you the quick facts for Nclex, unless you already have it, but then they'll send you your student workbook. Okay. Somebody says, I'm glad I signed up for VT. I'm loving it. It gives me more understanding about the content. Perfect. Yep. So yes. So that's what you get. Okay. God bless you and your family. I used your quick facts in VT only 2 weeks before my Nclex. You are so positive.
2 weeks.
I know. And I was not nervous and passed the first time on June 13th. Wow.
2 weeks.
Okay. So apparently you can do 2 weeks. Yes, with God it's possible. Wow. All right. Congratulations. All right. How do I join VT on? How do I join through VT on Monday Motivation? What does that mean? I'm not sure what that means. All right. No, you don't have to renew the question. In order to get access to the online question bank, you don't have to renew the VT at all. All right. At all. All right. If you have it in the past or have it, then we'll send you that link. All right. Where can I start from since I have forgotten everything? All right. So yes, Mark, they said the PN question bank book is sold out now.
Then it's sold out.
Okay. Where can I start from? Well, with actually the thing about my program, the beauty about my program is that when you start it, everybody starts from the same place. It doesn't matter if you've been out of school like 10 years or 10 weeks. When you go through the program, it will take you through a series of lectures and questions so that at the end of it, you're right where you need to be. So don't worry about where do you start, how do you start, just get the program, okay? And then don't forget, guys, once you pass and you send us your video, you get your ReMar nurse shirt, okay? You get your ReMar nurse shirt. Can you see it? These are the new ones that came in. So now we have them. Everybody that passes and does a video, you get to rock the shirt. You guys know I love my ReMar paraphernalia. So we have them for you back again. All right. All right. You got to do it. You got to pass. You got to send a video so we can do it. Let me see. Here we go. Thank you so much. God bless. I don't graduate until April. Would you recommend me to purchase the program? So you graduate next year. Well, this is what happens. What happens is this. Sometimes we'll have senior nursing students who will get the program while they're on break, and they'll use it to prepare for their exit exams. So if you have like a HESI exit exam or any kind of exams or finals and you want to be super prepared for them or go into your final year, like way above knowledge, everybody else, I would do the Nclex review because it'll help you. All right. We're expecting the question bank to be out by Monday. All right. All right.
You know you should do a live about the question bank to just show what's there.
Is that right now?
No, not right now.
Okay.
Just schedule it for this week.
Okay.
Just to show the insides of it. And then when it's out, you can still say, hey, it's out.
Okay. So Mark is saying I need to do a live about the question bank. So show you guys what it is. I already did that though.
No, they haven't gone inside.
Okay. All right. I can do that. So we will do a live about the question bank. All right. Okay, you guys. So how do I join Monday Motivations Live through VT? Okay. So the virtual trainer, inside the virtual trainer, there should be a section underneath your training center that says Monday or it says how to pass Nclex and then Monday Motivation. So you should see that in your training center. You offer a free trial of the VT. I don't have a free trial of the VT yet. All right. Mark is working on that though. It should be coming. Okay. All right.
This is the free trial.
Yes. I have the VT. I'm almost finished and just need more time to go back and start again. Can I just continue to pay the $69? You can. The $69 will give you an additional 30 days access into your virtual trainer. Okay. So you can just, it'll automatically renew it unless you canceled it. Okay. All right. Please do a live about the question bank. Okay, I will. I definitely will. I can do that. What is the price? Will the price of the question bank be included in my renewal? No, only because again, the question bank and the virtual trainer right now are not connected. So you have your virtual trainer, comprehensive review on the VT, and then your question bank will be on the question bank website. So they will have two different housing. And remember, with the question bank, you can purchase the question bank and then activate it later on. So for those of you who want to purchase it at the introductory price, then you will be able to do that and activate it later. Okay. Questions will be on the virtual trainer, or you will have a book. Questions will be virtually. Okay. Questions will be online only. I won't have any more books. For the question, I failed 2 times using UWorld and Hearst, thinking about getting the VT. More please on VT. Oh, if you, okay. So I know those 2 resources. You're going to love the virtual trainer. If you haven't ever heard of it before, please do yourself a favor and just check out just go to remarnurse.com and read the differences. There's going to be a huge difference in how you get that content, because with UWorld you don't get content. You get rationales that you're self-reading, and you get a lot of questions. And so that's good on the back end. But if you're not successful in Nclex, you need a lecture review, you need classes, you need dialogue, right? And so the virtual trainer is great at giving you that in a way that is not overwhelming. So my lectures in Hearst, I believe that the lectures can be like hours long. And so that can be overwhelming to some people. So I try to make my lectures very concise and to the point. And with the workbook that you get, it also has homework and practice exams after the sections, so that you make sure that you're learning. All right. Make sure that you're learning, but don't take my word for it. I'm telling you, it's the best thing I've ever done, but there's also people here on live that you can ask too as well. And it's not uncommon for us to get people to say, hey, I use other resources, and I'm not doing well. So actually, if we look here, I saw your question too. If you look here, we did a poll on how many on 15,000 students, and we asked them what did they use before studying with ReMar. And so this is what the majority of the students said, is what they said. So they use UWorld, they use Saunders, they use Kaplan. This is before they found us. So, right. So, and they have failed with these resources. So don't worry if you're like getting back on the horse again, or if you're trying to study again, you're in the right place and you're not alone. Okay. You're not alone. And so here, okay. So if you're in the virtual trainer, I'm not live right now in the virtual trainer. I'm live here on Facebook and YouTube, but we do upload these videos to the virtual trainer. Okay. All right. Okay. All right, guys. So I'm going to get out of here. Shanita, your lectures are wonderful. Thank you, Shanita, for being so complimentary today. All right. I need to ask questions. What's my WhatsApp number? Oh, no. So I don't have a WhatsApp number for you guys. All right. How do I purchase the VT workbook only? Can't purchase the VT workbook only. It comes with the package. So you have to get the full program for the VT workbook. Okay. Jerry says, I'm currently taking the review. It's extremely well. It's going extremely well. She's straight to the point. Pray for my success. Yes, praying for your success. Bianca, I'm officially a ReMar nurse. Took the exam July 17th and found out that I passed yesterday. Hey, Bianca, we did your story. Wait, we did it. I read your story. I gave you your ReMar roses. Did you see it? Did you see it? Hold on. Let me see if I can. Here you go. Is this you? Mm-hmm. Yeah, there you go. We shouted you out. Yeah, we did a segment about you. So definitely, if you did not see that, Bianca, go back, because we shouted you out. We gave you your ReMar roses today. So congratulations again. Thank you for your Nclex exam. I am super proud of you. Congratulations. All right. Let's see. All right. So here I am. Let's see. I am doing UWorld now, the DVD package last time. Okay. Your virtual trainer is so awesome. I advise everybody to get it. Can we pre-order it? Okay. All right. So no, that's it, guys. Every Monday, we will be continuing to go live for as long as I possibly can, or until I go on maternity leave. And then after that, I will see you guys in the virtual trainer. So I hope that you get it and you will continue to study even after I am on maternity leave. All right. There you go. Okay. Also, I will do a live on the question bank for you guys as soon as it's ready. We are so close to it. Like I said, it was delivered to me over the weekend and I was finally happy with it. The developer, okay, yes, everything works fine. This is perfect. So we are still like testing it. I made all of Team ReMar get it. I'm like, get the question bank team and then go through it. Tell me what you think. And I have some ReMar nurses going through it as well. But everybody is giving me good feedback on it. So I hope to open it up to you guys, the public, and I hope that you will love it as well. I'm kind of a perfectionist, so I wanted it to be perfect for you guys. I'm not going to order any more of the question bank books. I know they're sold out right now. I want everybody in the online question bank because honestly, is more questions. There's only in the question bank book, there's only 400 questions, but in the PN and the RN online, there's about 1,200. So you get more questions. You get to pick your questions. You have clinical math. If you're in the RN, you'll have clinical math. You'll have case studies. You'll have cultural competence and integrated concepts and whatever, everything else, med surg, critical care, everything that you guys told me you needed, prioritization, court, like delegation, infection control, all of that stuff. If you're in the PN, you'll have coordinated care, you'll have clinical math still, you'll have what else? You will have all the other med surge, everything except for critical care. I didn't put critical care in the PN. I didn't think you guys really, I didn't want you guys to focus too much on that aspect of nursing. But a lot of teaching in the PN, a lot of teaching. So I wanted you guys to know the follow-up teaching for different subjects. So I really think you'll like it. And I'm going to be really excited to put it out. And hopefully that will be this week. Okay. Let's see. I hope the lives continue until I test in August because they will truly build my confidence. I don't know how, please. I'm going to try to do them as long as I can. You guys see, I'm like getting bigger by the day. All right. Nurse Regina, when you start the before the books arrive section, can you leave it yes, you can leave that section once your books come. You can leave that section and go right into your review. Okay. All right. Ashley says, yes, you can leave it and then go back. Absolutely. Yes, absolutely. The before the books arrive section will have you in there for a long time. You got to know when to switch over. Somebody says, I learned better with the books. Okay. But you know what the question bank will be? I think the question bank will be a different experience because you'll get to immediately see your rationales and you'll get to review your quizzes. And that's one thing that I liked about having the question bank in a different platform is because after you take your quizzes, then you can go back and even the assessment, you get an assessment you either get one or two assessments with whichever question bank you purchase. And so going back and seeing those assessment performances are going to be very helpful. Can I use the question bank and quick facts to study? I wouldn't do that. I mean, I wouldn't do it without getting the virtual trainer. The question bank is difficult. From the feedback that I'm getting, I have a student in there who has done the virtual trainer. I think she's done it 3 times. And so she said she took a quiz, a practice exam in the question bank, and she did not do well on it. And so I know that the questions are difficult in there, but they're not meant to discourage you. They're meant to challenge you. So if you think you're just going to get the quick facts book in the question bank, I would not do that. I would not do that because everything in the question bank is built on principles from the virtual trainer, most of it. So definitely make sure you have the virtual trainer first. It's the virtual trainer question bank. So if you don't have the virtual trainer, don't buy it. Just don't buy it. You can get question banks from everywhere else. I don't care. But specifically, I have a purpose for putting out my products, and it's not just to sell you guys things. I don't want you to get the question bank if you have not done the virtual trainer. Okay. I want you to be able to do well. Okay. And actually, let's see. Not sure if you answered this. ReMar Nurse University. That's not up anymore. ReMar Nurse University. It will be going up in the virtual trainer. Okay. All right. It's going to be going back up in the virtual trainer. ReMar Nurse University is a one-time event, guys. You guys know that. You guys, that's why it's so important that you got to be there on time because we don't leave those videos up all year. We really don't. All right. Okay, guys, I gotta go. Monday, super busy today, but I was glad that I could take out some time to definitely spend with you guys, study, answer your questions. You know that we always say this, and it's the truth around here. We love you guys, but I can, I will, and I must pass Nclex.